Welcome to Fundamental Freedoms. Good evening. My name's Steve Burgess. I am broadcasting from my home in St. George, Utah.
And I'm David Sabine. I'm broadcasting from my home in Ontario. Please be sure to like and subscribe and share. Also, please know that Steve and I would like to have conversation not only online but offline and afterwards. If you wish to join our community at fundamentalfreedoms.locals.com. And we hope to carry on this conversation with you there.
So this will be part of our Connection series. Tonight we're going to be speaking with Chris Norman. He's actually a schoolmate. Some of you know that David and I are schoolmates, and Chris went to school with us as well. And he is in Regina, Saskatchewan. And so with that, let's bring Chris into the conversation. Hello, Chris.
Welcome, Chris.
Gentlemen, hello.
Could you please introduce yourself? I don't want to speak for you, other than to say it's been a very long time since I've seen Chris, about 28 years, I think. Please introduce yourself.
Thank you. Chris Norman from Regina, Saskatchewan, and pleased to be on with you guys and actually see you and call it in person. It's been a long time. Good to see you.
Well, Chris, Fundamental Freedoms is about three basic things. We believe that good society is based on good conversation, and so that's what we're looking to have tonight, is a good conversation. Maybe we can improve society in some small measure by just hashing out some ideas tonight with you. Our three basic premises is it's okay not to come prepared to do battle. You can start a conversation and just with the intent of listening and learning rather than wanting to start an argument. It's okay to change our minds, and it's okay to respect people that we disagree with. So let's get started.
I'd like to add, before we begin here, just before we get into conversation, there are a couple of basic ground rules that Steve and I try to practice. And we think that these ground rules will help us to keep conversation, even very difficult conversation, focused and respectful. So the two ground rules that we have in mind, and we ask our guests to observe these as well. One is we try to avoid undefined they statements. Steve, can you give an example of this?
They're going to steal my baby, or they're going to raise my taxes, or they're going to do whatever. You know, those times when we use the word they, and we're just talking about someone's going to do it, but we don't really have a good idea of who that is. And so we like to make sure we're defining that if we get into political conversations at all.
The second rule is that we are unique individuals. So too is our guest. So regardless of our affiliations and our memberships and our associations, none of us speak for a group. We can only speak for ourselves. So thanks for letting me interject that. And so Chris, just before we went live here, we were kind of reminiscing a bit and catching up. I was interested to find out your career, and that career leads me to want to know so much more about your experience in the past 6 or 8 months, and so I hope we can have some conversation about that and ask you a bunch of questions. What is your career? I forget, did you say that during your intro?
I work in emergency at hospital here, the trauma center here in Regina. I've worked in Emerge for 20 years. This is my 20th year, and it's
congratulations.
Great. It's you blink and time goes by, right? Through that, I had a bit of a stint in some politics nationally. Through emergency nursing, I was the director of emergency nursing for Saskatchewan. From there, I did branch out and did some work with transplant for a couple of years, but the entire time still worked within Emerge and still did shifts and have never left. Some people shake their head and ask me why, and I don't always have a good answer for that. There's a bit of an addiction piece to it, I think, to the chaos and the controlled environment that we have, and the absolute bizarre breadth of patients that we see and we've seen over the years. And so from there, kind of worked from the floor nurse and worked from in a small hospital in Regina. And when I first started, there was two of us that worked nights, and now that same hospital has, I believe, they're at a dozen working nights, nurses working nights. Um, there's a lot of change within the profession, a lot of change within our world in medicine, and I've seen a little bit of everything over the 20 years. I'm now the coordinator of the emergency department here in Regina, and that gets into some gray zones of politics within the system, liaison from, you name it, every system and department, everything from facilities, electrical, to ordering supplies and dealing with physicians and residents and nurses. And it's super complex, but there's a strange love for it, let me tell you.
Thank you.
So, let me broach the big subject of the day. Um,
Sure.
Obviously, we've got the COVID pandemic going on, and it unfortunately it's been completely politicized. It's been horribly politicized in this country. I can only assume it's similar there, and so it seems like every time you talk about it, there's this tension, or there's this I've got to be careful and tread lightly because I don't know which side of the argument the person I'm talking to is on. And so without, and I don't know, we've talked once in a while, and I haven't talked about the subject with you really. And so without wanting to know what side you're on, I'm really interested to know what your experience is with it. And I mean, I guess maybe the first question: how scared are you of the pandemic? Or maybe scared is the wrong word, but how concerned are you about the pandemic? Is this something that, from your vantage point as an ER technician, could it overtake the world? Is this a zombie apocalypse potentially if we don't control it the right way?
Well, it's interesting. You mentioned the political side of it. We see very biased view through media. Even our head of microbiology, public health, Tam, she sits beside the prime minister during press conferences, which leads a lot of people to believe or not believe. Is it opinion based on what she's telling us? Are they telling us all the truth? Are they telling us just enough to get us by? I don't know if we all have all the answers. And I think that's kind of been a common thread right from day one with all of this, and which has kind of fueled a lot of the angst. The idea of, am I actually dealing with what I know? Am I actually dealing with what's in front of me of what they're telling me? My personal experience from this, call it in the beginning, during the big quarantine, there was a lot of angst, not just public, but within the hospital. It brought a lot of demons out of a lot of people, and we lost a lot of really good employees at the hospital. They're just the reality of the danger of it in the beginning was a bit too much for people to kind of take on. And it took several months, 6 months, for people to actually come down and come to a bit of a reality of what we're actually dealing with. I mean, for myself, in order for me to cope and deal with everything that we were dealing with on a daily basis, I needed to kind of delve into the whole art of war piece, where know your enemy, which meant a lot of research on my own and a lot of research, like actual proper research into coronaviruses and how they typically spread amongst people, amongst animals, and getting right down into the pathophysiology of this creature that is attacking our planet. Um, Away from the social media piece, because that was um, a major part of the anxiety and a major part of kind of, lack of better terms, turmoil within our work and within society, was this absolute blanket of information. And there was 100 different ideas and 1,000 different opinions on what was happening and what we were going to see. I mean, we were told on a daily basis that any moment we're going to have 200 to 300 people on a ventilator, lining our hallways and completely collapsing our system. So I kept referencing on a daily basis this idea that I felt like I was standing on the edge of a cliff and just waiting for the wind to blow and just topple us over. But unfortunately, and fortunately, it never actually came to that. Excuse me. Not like other areas. I mean, we see places, Italy, New York, places here in Canada, Quebec. Um, they were seeing the worst of the worst, and we were told that we would get to this point, and it was inevitable. Fortunately, it didn't actually get to that point. So, digress. The whole art of war piece and know your enemy. Once I did my research and I understood who we were fighting, I had a better understanding and a better approach to just the daily workings. And then I could actually have those conversations with our staff and our medical microbiologists. We pulled them in, and a lot of the anxiety and a lot of unnecessary work was happening.
So you talk about the anxiety and with some of your staff or your workmates, the demons coming out. So they call this the novel coronavirus. Was that a novel situation for the hospital, for the ER staff? This was something that they hadn't quite faced the reality of before, something that would just be an overwhelming infectious disease.
Yeah, 100%. We have had many conversations dealing with the idea of a VHF infection, Ebola, dealing with our only experience with something big was SARS back in the day. It wasn't actually that long ago, and Toronto was our big hotspot, and we saw friends and family within the profession, people die. Um, and the idea of this coming again was a lot of table conversations, um, some upper level conversations and planning, but it never really reached to the floor level, as we call it, and the hands-on care. So when this actually hit, we were looking at an infrastructure and a system that is 100% not was never prepared to deal with what we're dealing with at this scope and capacity. Everything we did every day, and we still do, we're working within a system that is 100% not designed to do what we do. But I mean, the amazing team and the amazing teamwork that everybody had on a daily basis, and just you just suck it up and let's run, um, is what kept us all going and kept things going to get us to today.
Chris, can I ask you, what does VHF mean?
Oh, catch me on one. All right, it's a brain stall at the moment.
Oh, I put you on the spot.
No,
It's just that
All
you
right, no,
said an acronym that I don't know the answer.
no,
I
that's
don't know the
all
meaning.
right.
The other thing I wanted to ask you, so you talked about a kind of shift that took place where early on, you said, so many good employees were, for whatever reason, their own reasons, reluctant to participate or had to pull away or step back from the work. They're making their own risk assessments, obviously. But then you said later on, 6 months later, that level of stress isn't in the environment right now. And I wonder, is that because the opponent turned out to be not as formidable in this war, or that the system that you work in, the environment you work in, was able to develop new process, new patterns, new techniques to make everyone involved safe. So which was it that you? And if I can just ask you not to kind of cop out and say, well, it was both, but was it one or the other really?
Well, to do a bit of a cop out, it is a bit of a combination of things. It's such a massive collaborative effort there.
Fair
But
comment. Okay.
to try and find some specifics there, I think initially because it was so new, there
Mm-hmm.
was so much of this broad spectrum social media piece that everyone was feeding on initially, that there was a lot of assumptions. We initially started out in Emerge. Um, a lot of my colleagues called it a nuclear hot zone, where if there was even a potential of a COVID case,
Mm.
we would absolute gear up, full gear. No one was allowed in the space except the staff member working in there. It was essentially a complete biohazard clean in the space. We shut down, call it half the department to accommodate just the potential of these patients, although we weren't seeing any. And again, as we started to learn uh, what we were actually dealing with and ways to deal with it, it started to bring a bit of the anxieties down, and we just naturally became a bit more comfortable. Through that, I mean, we were completely over the top initially in dealing with what we thought was, if it was even in the building, it'd cook your face off type deal.
Mm-hmm.
But we had medical microbiologists come down, and their their knowledge just kind of blows me away. They were able to say, "Excellent, good for you guys. You're being safe, but it's unnecessary. These 10 different pieces you can actually back off, and you're still within safe margins and safe zones."
Could you
Which
could
the
you give
staff,
us, like, this is fascinating to me. Could you give us some
yeah,
concrete? So
oh
how has
sure,
that protocol changed?
oh
From one person and everyone, wrapped up and suited up, and like, what sort of protocols are now in place
well,
or
initially
normal? What
closing
protocol is normal now?
our, initially closing down half our department. We took a hallway, and we sealed it off one end to the other, and you couldn't walk in there unless you were in full face shield, gowns, booties, gloves, hair nets, you name it. Just all the things you do see on TV. And again, we considered that a hot zone. Our X-ray wouldn't go in there until they were full suited up. Our lab techs wouldn't even step foot in the area. We actually certified all our nurses, to draw blood so that the lab techs couldn't go in there and do phlebotomy, because they didn't wish to actually go into that zone and make put themselves in danger. So that was in the beginning. Now we're regular working in Emerge, as we were a year ago, just now with isolation patients in their rooms. Although saying that, operational needs really challenges some things. That's the whole sidebar conversation. Um,
Can I ask though?
so we,
So
yeah,
you're I forget the phrase you just used, but you're essentially working as you would have a year ago. Is this because you're not having coronavirus patients in the building right now, or
No,
if a person with those symptoms does come in, does everyone get suited up again, or basically not? You're keeping a mask on, but otherwise going about your work as you would have a year ago.
yeah, it's really interesting, and bizarre at the same time, because the only way I've been explaining it to people, I call it backwards math, is that in the beginning of the whole quarantine, there was a potential for patients. We didn't actually have any. We were seeing what was happening around the world. There was some within community, but we weren't seeing it at hospital. We were seeing just regular sick patients. But we were 100% uh, full containment. We were, you know, I would make a phone call to facilities, and I said, I need a door right there. Build me a door. I would have 5 guys there within 20 seconds, and they'd have tools in hand. They say, how big you want it? And they would cut open a door and create exactly what I wanted. Um, so from that crazy extreme, with 0 patients, to today, where we have COVID patients coming through the hospital all the time. They come in from community. We come in, we test them, we discover they're positive. But we don't have all of the extremes. It's normal working process now. We've actually gone back to all of the things that we normally have done for 20 plus years. Because again, we've kind of realized that the work that we do still keeps us safe. Though we have introduced different measures as far as wear masks all the time. We wear goggles with every patient exposure. Anyone who's suspected of COVID, there's full gown, etc. But again, those aren't new processes. Those are something we've always had around. It's just we consistently do it now. So again, this backwards math piece where intense work and hourly changes for several months with 0 patients, but now we have multiple patients, and it's just daily work.
So Chris, so this is interesting to me. I think people that aren't in the medical profession, they get feeling like there's this wall, the hospital wall, and so I'm stuck as a layperson, and I have to just kind of sort through Google and whatever Dr. Fauci tells me, or whatever the medical the health people. I mean, not health professionals, but like health department politicians in some cases, or wherever, what they're telling me, and then what I can glean from Facebook and social media, which is pretty pathetic place to go and study, and then you assume that everybody on the other side of that wall has all the answers. Like they're over there, and I'm like, how come they don't have just a doctor come out on the news and say this is what's actually happening, or this is actually how coronavirus works? And a couple of the things that you've said make it sound like, in a lot of cases, the phlebotomists, the nurses, the frontline people, they're getting a lot of their information and worries and from the same places I am.
You're totally right. The nurses that I work with, they initially were getting all that information just through social media, watching the news. But it was 20 different sources at all times, and there wasn't a consistent venue for it. I think within our hospital system, there was some recognition of that, and our head of microbiology, she actually started having, I think, call it every 2 days. She would have a phone conference, and we would play it over the speaker phones over the entire department, and that would be our source. That is the source of knowledge for everyone in the building, and we were free to go in and ask questions, and she would, be completely upfront and answer as best she knew. Now, I think there's a bit more standard knowledge. But I think there's still a lot of unanswered questions too, and for good reason. The fact that this is new. We don't have stacks and stacks of research papers that have studied this virus and have all the answers. This, I want to say, quote unquote, isn't even a year old yet. We're close. Yes, we've seen coronaviruses in the past, but not this one. In me trying to understand the science of it all, this one, shy of SARS, started killing people. Where a coronavirus is, for lack of better terms, is a cold. But this one was different. And this one spread around the world faster than they've ever seen and started killing more people than what they had expected at massive rates. And another piece, too, is the demographic of who this virus goes for is really different from most illnesses that we see. Elderly versus children, where this attacks the middle, which is completely new. So because of all those things, again, back to what I said before, started fueling that angst piece. But as you gain knowledge, you start to understand and you know better how to kind of attack it, to use your war terms.
There's another piece of this I'd really like to understand, and that is to, if you're willing or able to tell us what sorts of things have changed since pre-COVID that you think might be now with the health profession, or maybe even specifically with Regina's hospital administration and operation going forward. Like, what I mean is that it's easy to look at all the things that have changed in the past 6 or 8 months. Gosh, there's been a lot of change there, but has any of that change been like foundational and systemic that you think the future is somehow
Like there's just
different
like we're just
than
going
the
to
past?
we're going to proceed differently than we have before. I mean, fundamentally, the way we provide health or something.
I want to say, I mean, by no means am I a sociologist. Am I a pro at dealing with critical social theory? But I want to say that within society, we've already seen that these massive changes, but I don't think they will be sustainable once, if you can say it, Corona goes away. I want to say we'll go back. I don't know society-wise if we have really built anything to say this needs to stick or this will stick, with exception to, say, hand washing and the massive sales of hand sanitizer, right?
But if you could bring that really local and in
Yeah,
your experience, like rather than think of like society at large, but like
yeah, for sure.
very
Um,
localized.
for call it nursing and work and the healthcare profession, I want to say this is really hammered down the idea that we're not recreating the wheel on a lot of things. The idea of wash your hands, the idea of wear a mask in a contaminated area and wear your goggles, wash your hands, wear a uniform, are all things that doesn't seem like rocket science, right? Let's say a year ago, those were things that we really had to pound into staff. We really needed to tell them that be safe, make sure you're doing these things, or bad things could happen. Call it complacency on a lot of levels. And it's not to blame any individual person or group. It's, again, that's society. We get complacent. But now, since this corona beast has reared its head, um, the idea of, oh, maybe we should have been doing these things all along and consistently. We were wearing goggles and stuff in big bag cases, but it wasn't all the time. And now we see it's all the time. Those are the things I could see are going to stay. They it, it's now it, it's now daily routine. As far as big infrastructure changes, I think it's this whole event has really opened the eyes of our upper echelon and the big ivory towers to the fact that, holy, our system structurally, physically is not designed to do any of this. And Lord help us that we don't need to do this again within the next 100 years. I think the next hospitals are going to be completely different. Everything from air exchange to how patients flow through. I think there will be big changes going forward.
Can we talk about vocabulary just briefly? So the what's the correct medical term for COVID-19? Is it SARS COVID-19-2? Or am I
When we look up patients' results for a COVID swab, it's a SARS coronavirus,
okay?
and it's coronavirus 19. Yeah.
And does the -2, does that denote this is the second major version of SARS within the
Um,
coronavirus spectrum?
yeah, that's my understanding of it as well. And the whole 19 piece, I just come to the understanding that 19 is it happened in
It just
2019. Not
happened in 2019.
in a row and just happened to be that way. I mean, I could be completely wrong. But that's my understanding of it.
So when I was a kid growing up in Canada, it always chapped me when people from the United States of America would call themselves Americans, because it's like, there's a lot of other countries that could call themselves Americans, anybody in North America, South America. And so with COVID, the COVID-19 is a strain of coronavirus, and coronavirus means, like, a lot of people are just calling it the coronavirus, but coronavirus is a complete spectrum
Yeah,
of disease. Is that correct?
yeah. It's like calling it Kleenex. That's one brand. Where coronavirus is all of the brands. It's where COVID-19 is this one that we're dealing with today. Again, a coronavirus. There's lots of them out there. Your common cold is a coronavirus. And again, which if you truly understand what a coronavirus is, it's interesting. It's really bizarre that it's doing what it's doing, um, and how it's actually attacking people. And oddly enough, you know your enemy, but you start to love it because it's so bizarre, and it is amazing that, I mean, it's a virus. It's not even alive, and yet it's destroying so many people.
Yeah.
It's
Chris,
amazing.
there's something I was trying to understand early on here, like March, April. I was thinking, haven't we all by now, like what, from your perspective, how often do you see MERS or SARS or Zika or the swine flu, or like haven't we all by now been exposed to these things? And for so many decades, we just went about our lives and knowing that these risks were out there, and we'd eventually contract one of these things, and maybe we'd have a vaccine this season, and maybe we would not get the vaccine this season. And like, what percentage of the population do you think has already had some of these very serious ailments before COVID-19 hit?
For for Saskatchewan, it we don't see MERS. We didn't see SARS. The
Are you
original.
routinely testing for these? Like if someone shows up with symptoms of this or similar symptoms, is MERS being tested or SARS being tested?
Um, let's use Ebola for an example.
Sure.
Ebola kind of has its hot moments within the year. It ebbs and tides when we don't always hear about it. It's whether the media buys in and tells us there was 2 Ebola cases, wherever in Africa. Um, but if, like the last time Ebola kind of spiked, um, it became a hot topic and we were on the watch. We changed our criteria within our triage process in Emerge, so that we're actually heightened and looking for the signs and symptoms and the potential if somebody's traveled to high risk areas, that sort of thing. And from there, we have had a couple, call it a handful of moments at both our hospitals where somebody may have traveled or somebody has an exposure to someone traveled to a high risk area and they do have some symptoms. And then we would then trigger all the kind of flags within the system to then investigate the patient, isolate the patient, and inform those who need to know, everything from our physicians to administration, medical microbiologists, and all that. We do have processes in place for that. But as far as actual positive cases, it's just not. It doesn't happen here. Will it ever? Huge potential. I mean, we have an international airport here. People travel in and out, and the cultural diversity globally is people are free to travel. So there is potential there, but we just don't see actual cases. And be it that we're right in the middle of the continent, our population density is extremely low compared to many other places. You've got your high end of New York and our big cities in Canada: Calgary, Toronto, Edmonton, Vancouver. Regina, Saskatchewan, we just don't have that dense population. We're primarily kind of out within the countryside, people on farms. And again, that's part of the reason why I think we're not seeing the high COVID cases as well, because we are spread out. We're not packed in and stacked on top of each other like many other places that are seeing massive numbers.
So what have you changed in your own family? So for me, I'm not attached to the healthcare industry at all. I'm not seeing. I think I've known like maybe 1 or 2 people personally that have had COVID, but I haven't been personally affected really at all, so to speak. And and so as far as what I've changed in my life, the only things I've changed are what I've been asked or forced or directed or whatever to do. And I comply with some of that and truthfully don't comply with some of that or whatever. But from you, like having seen some cases, treated some patients, probably had some experience, is there things that you have done differently with in your own home, in your own life, in your own interactions with, aside from your work?
I think from your questions, this is kind of where I see some of the positives of this whole pandemic. Is that, especially with my family, it's really, I've come to appreciate a lot of the little things that, call it, I took for granted before. A year ago, we were so busy running the kids to every activity. Every hour of their day was planned, whether it was sports and just entertainment, running them around, the family taxi. You understand?
Yep.
Yeah, and now um, we're forced to now. We can't go to all these activities because some of them just don't exist, or restricted hours and etc. We're now kind of realizing, oh, right, we have this family that we need to spend time with. We now have a dog. We um, we actually hang out. We go for walks. We do all the things that family, you know, can and should have always done, um, away from this chaotic, manic type lifestyle. And I do appreciate kind of where we're at now. And I do see that not just my family, a lot of my friends. they've kind of stepped back and taken this aha moment. It's like, oh yeah, this is what we used to do. This was 25 years ago when we only had one activity a year, whether you played baseball in the spring or you played hockey in the winter, and you didn't get to do five others. Now we actually do family stuff, and to seek a positive in everything, I think that's mine.
So, my family's had the same experience, not going to church on Sundays for for several months there. Like you said, extracurricular activities kind of all of a sudden just cut off. And generally, you know, I would have went to Hawaii this year. We didn't. We would have went to Disneyland as a family. We didn't. And just lots of things. And so we ended up just out in the local area doing hikes and walks, and it's been, that part of it's been great. And and but I don't I was having a conversation with my daughter. She's up in college, just an hour north of here, and she was really in tears the other night, just talking about, I'm 19. I didn't I didn't get a graduation ceremony. I didn't do all of those normal things. I had a senior trip which I canceled. I had a couple of friend trips this summer which I canceled. I'm 19 and freshly in college. I should be dating and doing things, and I just don't see anybody. And about three-quarters of her classes are online now. And she said, so I got this dorm so that I could get out of the house and have all of these experiences. And I find myself most of the time at home in my dorm on my bed, attending classes virtually and doing homework. And then, and she said, and then to boot, yesterday we got a text from our landlord saying, don't forget to wear your masks inside the house. Like if you're leaving your room and going to the bathroom or going downstairs to get a sandwich, remember that there's six roommates that all come from different households. And so you want to make sure you're not spending time with them or mingling too much or whatever, and wear your mask as you're outside of your room. And her room's like 20 square feet. So she was just, and it's the I mean, kids are amazing and resilient. My kids have gotten used to the mask wearing and a lot of different things pretty well. But just talking with her the other day and realizing from her perspective just the weight, emotionally, and the toll that it's starting to take. No concerts, no dances, no, so many little things. And I don't. I'm sorry that I don't know that that's a question.
Well,
It's
I
just
want to follow up on this if I can. So, and I think there is a question here. And so, some additional context for everyone. Chris mentioned that I almost giggled a bit because he said both of our hospitals. So, Regina, Saskatchewan is about 200,000 people. There are two hospitals. And I think, correct me if I'm wrong, Chris, but I think there has not been a fatality due to COVID-19, except one fatality since early August, I believe. And you said yourself in our conversation here that you haven't been seeing these. Well, you've been seeing some cases, and you're taking appropriate precautions, but not all the hazmat suits and everything. Meanwhile, the city that you work in has gotten more and more restrictive over time, it seems. Like they relaxed the rules a little bit in June and July, but just recently, within your city, there's just masks everywhere. I don't know about even in schools, but the question that I think that arises from Steve's experience or his daughter's experience is what sense do you get that a balance is being discussed among health professionals? The balance being, what level of resilience do we expect from our youth versus how much actual precaution must we take, to cover our faces and so forth. I'm not a fly on a wall talking with the head of microbiology, for example, in your hospital. I'd love to know what they're thinking and talking about. Do you have a sense of that?
Yeah, again, I referenced the idea of this backwards math. We had in Saskatoon, they set up which was called an Emergency Operations Center, an EOC, during right at the beginning, dealing with all the potentials of cases, and yet we saw zero. And now we're just kind of hitting this edge where about 200 cases a day, but the EOC is gone. So again, there's confusion within the healthcare system amongst the minions, us nurses, where the idea of a lot of power, a lot of effort, and a lot of sleepless nights gone towards the system with no patience, and yet now our system is completely strained. We're with regular everyday business as well as 200 cases a day within the province of this potentially lethal disease. But we don't see the intensity from above. There's no operations center. There isn't hourly changes. There is no interest to try and get these patients in and out. It's not
hold
just
on.
emerge. The whole.
I broke the first rule of interviewing and I interrupted my guest, but is it,
No problem.
you're not seeing those protocols? Those protocols aren't being enacted with the intensity that they used to because they aren't as necessary as once thought, or there's just fatigue in the system and like people just aren't doing it? Like, what's the reason?
Unfortunately, I don't have an answer. It's that's where the confusion piece comes in, and hopefully, at some point in time, someone more important than I will explain it to me. Or was the intent to put all the effort forward in the beginning to set up so that it's sustainable? Although I can honestly say that it's not working whatever they planned. Um, because we do have severe backlogs and patients lining in hallways, and a lot of things are just worse than they were. And there's only so much we can do. We want to care for people. That's the nature of our business, and that's why we've gone into this. Unfortunately, there's limitations to it. I can only do so much. My colleagues can only do so much in a day, and we leave many days really disappointed that I wish I could have done more, but we can't.
Put that into context, though, with what you said earlier, Chris, where you said early on a lot of the employees were highly stressed and stepping away from the job, whereas now they're not nearly as worried about it. They're like, that seems contrary to what you just said, but I don't think it is contrary to what you just said. Can you help me understand that?
Yeah, the angst and the worry initially was dealing with the potential and all the things that we were hearing that we were seeing pictures on social media of nurses that are working and their faces absolutely excoriated,
Yeah.
and skin peel, because of so many hours of working. And at that time, we weren't seeing that sort of thing. So there was a lot of visual that the staff were seeing and this fear of the unknown. And now that we have established a new baseline and a new sense of work, it's not so much the angst of what we're dealing with, but there's the angst and the worry, the stress of the workload, because our system is now back to normal operations. We There's no restriction on what comes through the building. Our regular surgeries happen throughout the system. Outpatient areas are all full open. as well as add all these things on top. We have, let's pick a number, let's say we have about 33 beds in our emergency department. And I'm sure there's hospitals that have 150 beds. We have 33. But we run most days with 70, some days 80 patients within the departments midday, and that's normal. So when you look at 30 spaces and now 80 patients at one moment, that's not 80 patients in a full day. The workload and where do you put patients and how do you create flow and how do you actually care for people that you want to care for becomes a real strain on the staff. Doing they want to do best they can for the patient, but again there are limitations and they can't do that.
So this
So
load, sorry, Steve, I'm going to ask one more question here. This load you're currently seeing in the ER, or sorry, in Emerge, I guess you'd call it, is that common? Is that the kind of load you would have seen a year ago, 3 years ago, or is it something new?
Being overfilled in Emerge isn't new,
Okay.
but now let's say a year ago we may have had 80 to 90, even 100 patients at times in the department. Those, but we didn't have the additional 100 extra processes, standard work, we call it, protocols in place that have been developed and built over the last 10 months, added on, as well as the addition of increased isolation precautions, which means you have to go through different procedures to get into a patient's room, where a year ago, we would be down 2/3. So there wasn't as much of those additional work pieces.
Thank you.
So there's a common narrative that we hear here about, well, the reason that the hospitals are overwhelmed now is because they were closed. Essentially, all the elective surgeries and some of the preventative things, that procedures that should have happened, March, April, May, June, are now kind of all hitting at once. But that wouldn't affect the ER. That would be maybe other places in the hospital. Do you see that? I mean, is the rest of the facility overwhelmed with a backlog?
We don't. Well, it's complex. We have always seen increased workload during times where wait times for surgeries and elective procedures, that sort of thing, where those times go up. We do see patients because people aren't dumb. They will go to and get what they need when they need it. If they see that I can go to Emerge to get my thing fixed, they'll do that. And there's no damning people for doing that. People are resourceful. They're just trying to get the things that they need. So when the system breaks and they now have to wait 6 months to get a hip, and they'll come to Emerge and say, I can't wait that long. I'm in too much pain. Help me. And as Emerge, we don't say no. We'll help anyone that shows up at the door. It doesn't matter who you are. So we have seen patients show up with those sort of things. Have I noticed since return to normal business increase? I can't say that I have. And if it is there, it's just blurred amongst the 100 other epidemic things that we see on a daily basis. And it's interesting you say that you mention other hospitals, because I can honestly say that none of this stuff, I don't own any of it. Our hospital isn't some special place that, ooh, woe is us, as far as we have long wait times and we have backlogs and we have patients lining our hallways. It's everywhere. It is an epidemic, pandemic within itself, global. Emergency departments around the world um, all have backlogs. They all have, you know, patients that line their hallways, and they have trouble getting their patients from emerge up to admitted areas. There is systemic issues that affect directly, and it is global. Some places just do it better, and it comes down to, you know, business, politics, and money. Um, I pick three things to try and address every issue daily, and it's time, space, capacity. And if I can't fix something, it's usually what to do with one of those things. And again, it's not just it. I don't own any of it. It's global.
This has been
It's
really
fast.
fascinating.
It's a
So
really fascinating conversation. Yeah,
I want to highlight, I think we asked Chris for about 45 minutes of his time, and we've been talking now nearly an hour. I've learned a lot. And Steve, maybe one more question, if that's all right, Chris.
Oh, absolutely.
Oh, a question to me. Oh, wow. Um, well, let me ask you let me ask you the elephant in the room question. Um, and I don't mean to put you on the spot, and I'm not asking for your opinion as an epidemiologist or even as a healthcare professional but do you believe that
Eager to this one, yeah.
what's that?
I said I'm eager to hear this one. What is that?
Uh, do you believe there is a point, maybe it goes without saying, um, that the cure could become worse than the disease? And and are we approaching or have we crossed that point in and maybe that, I mean, I know there's a lot that goes into that and it's regional. Not every state, not every province handles things exactly the same way, and there's not the same restrictions or whatever. But that's my that's my fundamental concern right now, honestly, with COVID is on one side of the scale is the number of deaths, and that has a as a number in ultimately in lost years of life. But on the other side of the scale is more uh, simple and more nuanced diminishments in quality of life, but there's a lot more people on that side of the scale. And I guess, can the cure become worse than the disease?
All right, that's a deep question. The the whole idea, like I said, do I believe that if and when this is all done, will society go back to the way it was and or become worse? Well, there's a huge chance of that. We've seen it before with many things, whether it's, you know, a tornado runs through a city and everyone binds together, and, you know, humanity, you know, finds itself and they work together to rebuild their communities. And 2 years later, you're you see that they end up kind of right back to where they were. People start separating. You start having your, you know, intercommunity cliques start to develop again, and you call it right back to quote unquote normal. Would I see this on a global scale? Absolutely. Um, I'm sure there's many people that would argue with me and say no, humans are better than that. I'm a bit of a realist. Um, you see it on small scale, and there's no doubt that I think we would probably go back. As far as the whole vaccine piece, and is the vaccine worse than is the cure worse than the disease? Without tempting the idea and having bringing in the anti-vaxxers, and I I really hope that science and the effort that's going into developing that they do it right. We saw, I think, medicine learned with the TB problems back in 50s, 60s, 70s. It's still here. they developed the vaccine. They tried to give BCG, and it was under tested, and it's a 50-50 whether or not it gives you TB or whether you just didn't get the disease. So with the COVID vaccine, I truly I believe in my heart of hearts that science will prevail and they'll do it right, and they won't put it out preemptively, and they'll do what they need to do. Um, I don't know if that'll answer your question.
I think, well, and yeah, the cure, I wasn't specifically thinking of the vaccine necessarily, but actually
Mm-hmm.
just
Right.
the mitigation, the ongoing mitigation efforts and the effect like that it has on society and sociality and everything else. It, but it's interesting. It's just I think what I've learned is it's just very nuanced. It's extremely complex, and it's like, sometimes we try and simplify things, and it's like, well, you get sick with the COVID, you go to the hospital, and there's just a bunch of like those docs with their medical kits from the Little House on the Prairie, and they just fix you, and it's so much more, complexities, and a hospital's full of human beings with special training, albeit but still human beings, and so you have the same sort of politics and worries and concerns, and yeah, uh, it's not an easy question.
So there's
So
another way to ask your question, Steve, and I think we can ask Chris without Chris, without requiring you to speculate about others, but actually ask you about your observation of others. And so I'll try to ask the question here in a different way. Certainly, there's talk around the water cooler and around the coffee amongst yourselves in the emergency department. And so, as different provinces in Canada implement these restrictions or rules, for example, Quebec tried to get the kids back to school, and they did so with forcing everybody to wear masks and stay 6 feet apart. Or there's, Nova Scotia has basically locked down completely, even though I think they've got 2 active cases today, or don't quote me on that. Prince Edward Island isn't allowing travel in or out of the island. Meanwhile, Alberta is relaxing a lot of the restrictions in rural areas. Saskatchewan too, relaxing those restrictions in rural areas, but keeping these restrictions tighter in the urban areas. So I think the question can be asked of you this way, to say, as those restrictions are discussed amongst the people you work with, is their response to that generally positive or not? Thankfully, such and such province is implementing new restrictions, we should do that here too. Or, those restrictions are imposed in Peel region in Toronto, and that's absurd. Or like what's the general sense that you get as people react to these kinds of restrictions?
I get the sense that um, kind of our cities and regions, we're almost all siloed, to the point, or to the level that we even look at Saskatoon, and although it's 2.5 hours away and we're within the same province, we see their numbers and we see their changes, but we just kind of sit back and go, wow, that's unfortunate for them. Let's just see how we do, and we'll try kind of we'll try something else. We'll learn from their experience, but we'll wait and see.
Okay.
And I think we've done that kind of from the beginning. Started in China, and as it moved around the world, we saw the Italy, call it almost melt down, and we slowly started making some changes and anecdotally kind of making our own little notes to say, this was their experience and this is what they went through. How can we mitigate that before it even gets here? And or when it does, what are we going to do different? I don't see a lot of change based on other areas. Quebec, we see it in the news, and they had 1,200 cases in a day. We don't make changes based on that. It's simply just news, and you shake your head and you hope they make it through.
Yeah, okay. Fair.
Hmm.
Thanks for the response.
No worries.
This has been a really cool conversation. It's good chatting with you. Appreciate you being so open. It's just, as it's it's put your profession and similar professions right into the forefront. Everyone's wondering like what's going on behind those walls, and so it's interesting to get a little bit of firsthand perspective about what you deal with and how you see it and what you're experiencing. So really appreciate your time.
Yeah, there's. I really think we've kind of talked within our hour here, less than 1% of the conversation.
Yeah,
We haven't even talked about the economic piece, the socioeconomic piece, political, and I think it's something that's going to be discussed for the next forever. It's going to be a long time.
Yeah,
I
I
hope so.
suspect I
Yeah.
suspect we'll have conversation about that and maybe bring you back on as a guest. My inclination here, Steve, is that we say goodbye to Chris. Maybe you and I have a bit of a debrief and then close it up. What do you say?
Yeah. Chris, thank you very, very much.
Thank you, Chris. It
Thank you.
was very nice
Well,
to see you again after all these years.
certainly. We'll see you again.
Okay. Good
All
night.
right.
Just remember here, you're going to want to either leave the meeting or mute, because I'm going to hide you on screen, but we're going to still be able to hear you if you're, unless you disappear. Okay.
No problem. Take care.
Thanks, Chris.
Bye bye.
Wow, Steve, I found it really interesting just to hear some really concrete discussion about their current experience and compared to their experience 6 or 8 months ago. Particularly that they're going about their days mostly normal with standard operating procedures, plus some minor adjustments such as wearing a mask most of the time instead of uh, a smaller portion of the time.
Yeah. I I I kept trying to bait Chris into commenting on the political aspects of it. Like, so, and boy, as much as I want to stop myself from saying, well, what side are you on of
Yeah.
this great debate? And what's interesting, as I talked to Chris a few days ago in preparation for inviting him on, and he said he spends almost no time on Facebook or any type of social media. He watches a lot of podcasts. He's a Buddhist. He spends time researching topics that he's interested in on his off time, and it really gives me pause personally and think, because I kept asking him questions which seem obvious to me, and he wasn't answering them out of almost out of naivety or ignorance. He just hasn't heard all of these, well, it's this way or it's that way or this conspiracy theory or that one. I don't think he's aware of a lot of it, and I'm like kind of jealous.
Yeah, I watched Dave Rubin's the Rubin Report, and over the past number of months, Dave Rubin has been talking about what he calls the war on reality. And it seems that if you are paying attention to mainstream media and general social media, there definitely is a war happening on reality. It's difficult to know how to navigate that. So I did appreciate Chris not taking the bait, so to speak. And yeah, I don't really have much more to say other than I want to kind of soak it in and
Yeah.
think carefully about what he was sharing with us.
Yep. I like this conversation. I'm excited to do more. So I thank you, David,
Yeah, thank
and
you.
thank you to those who listened or will be listening in the future from our archives, and
So
have a
just a
great evening.
reminder that we please share and like and subscribe if you wish. Steve and I want to have some conversation amongst ourselves, but with anyone who watches our conversations, at locals.com. It's a platform where you can sign up and then find our community called Fundamental Freedoms. And once you've been part of the community, you can comment and discuss and get in touch with us personally. That would be really great. Look for promo codes below the video or beside, or I don't know where the link will be in the interface you're looking at. But we'll put promo codes there so that you can join the Fundamental Freedoms group at locals.com for a few months for free. And I think that's about it. Anything else we need to say?
No, I think we can say goodnight.
Oh, we will say this, that we hope to have, we might have a very exciting guest next week. Steve, I want to talk to you about it soon. Maybe we can set up a night. So look for that, and or hit that little subscribe button or the bell icon if you want to get a notification. So as soon as we know when the next conversation will be, you can get notified of that.
More to come.
More to come.
Thank you.
Have a great night.